yeah, really excited to talk a wee bit more about this training program. And this is a partnership and collaboration between the National Centre for Remote and Rural Healthcare, and we've framed it around remote from rural island health and care research from foundations to collaboration. It's a fully funded online training program for healthcare practitioners working in settings in Scotland between October 2025 and March 2026. Very briefly, we're really happy to be delivering this. Science Ceilidh is a social enterprise. We support cultural and knowledge democracy, and so we run a whole bunch of different programs across Scotland. A lot of our work historically was more in education, looking at transdisciplinary learning and pedagogy. We do a lot of work within the community learning and development space, particularly with youth workers, but also working with different adult communities, New Scot refugees, for example, over long periods of time, building relationships. And in the last 5-6 years, we've really focused a bit more on different funding programs, looking at supporting community-based research and community-led research. So things like the Ideas Fund, which funded communities directly to be the principal investigator, to lead research projects in the Highlands and Islands, particularly around mental well-being. We have climate change programs, and a lot of our work now is looking at supporting community partnerships, more equitable work with communities that doesn't feel extractive, for example, and maybe addresses some of the challenges that can happen within research in rural and island context. One of the ways that we do this is through our network, which is funded through the Ideas Fund as well, called Community Knowledge Matters. And this is a network looking at supporting community-based research, particularly in rural and island Scotland. Historically, it was Highlands and Islands, and we've broadened that out. We have online network meetings and community practices. We trial new infrastructure programs, so things like we're developing new ethics processes which communities can lead. We've developed a co-priority survey, looking at kind of needs of rural communities, and that was developed with a working group including community members themselves, and then analysed with community members. And now we're working on developing creative ways of sharing that data back to communities, and also influencing policy change through the data that was collected as well. So we do a lot of work around this space. And for example, we've got a gathering coming up in Inverness in November. So if any of you are interested, you'd be very welcome to join us. I'm going to hand this slide over to Carrie about who the National Centre are.
Yeah, thanks, Lewis. Hopefully by now you'll have heard of the National Centre for Remote and Rural Health and Care. We've been on the go for about 2 years now. The need for the centre was actually identified in a report that was what was it called? It was something like the Skye and Loch Alsh out of hours review or something like that. It was done by Professor Sir Lewis Ritchie many years ago, and one of the outcomes of that report was that there was a need for more dedicated education and training and support for remote, rural and island areas. So, cut a long story short, Scottish Government put it in the manifesto, and in October of 2023, Scottish Government issued a 2-year funding pot to NHS Education for Scotland to kind of organise that, to run that centre. Now, NES already at the time had a remote and rural specialist team, which was the real team, the Remote and Rural Healthcare Education Alliance. So really that's the funding that was provided by Scottish Government's gone alongside the money that NES already had as a specialist board to provide that education. And it's just meant that we can do more, so we've got a whole bunch of programs. I think we've got something like 30 programs of work on the go at the minute, which is tremendous. And hopefully the remote, rural and island areas of Scotland will be seeing the benefit of that over the coming years. The little graphic there just indicates the kind of 4 main priority areas of work that we focus on. So we've got education and training, obviously, because that's we're the specialist education board. We've got recruitment and retention, because that's a huge issue in remote and rural areas. We've got leadership and good practice, and then the most relevant for this is research and evaluation. Now, Sarah Ann, who Lewis mentioned earlier, is our head of program for research and evaluation. So really, it's her remit to really promote, push, encourage engagement in research and evaluation, as well as making sure that we create that really strong evidence base within the team. So we are absolutely delighted to be working alongside Lewis and the team on this project, just to really promote and encourage practitioners to get involved in research. It's you guys who create the most valuable research that we can do in these remote and rural areas. So yeah, really hoping you find this information session of interest and want to sign up for the course. I kind of want to sign up for it myself. I've not long finished my PhD, but I kind of want to sign up for the course as well. Having seen some of the material, it looks fantastic, and with it being sort of community focused, I'm attending all the sessions anyway, so I'm sure there's a lot that I'll learn from it as well. Yeah, but any questions about the National Centre, please feel free to drop me a line, with this session. I'm happy to have a chat with anybody about other things that the Centre does as well. But hand back to you, Lewis.
Thanks, Gary. And no, I'm really excited to be working with you too. And I think what is a really active partnership in the sense of there will be integrations and a lot of the discussion about the in terms of the training course and how the kind of the policy implications or the kind of change of practice will absolutely be fed into some of the other work streams that NES is doing as well, which I think is going to be really exciting. Just very briefly about the aims of the program. So from our perspective, it's really about looking at supporting health and care practitioners like yourselves to feel more confident about conducting research and evaluation in remote and rural and island contexts. Small side note, we definitely appreciate that terminology is always interesting. So not everyone likes the term remote, for example. And so we're obviously using all of them, but just a small caveat in terms of appreciating that people like different terms differently as well. Of course, we're really particularly interested in supporting approaches which are participatory, that are place-based and relevant, and very much in collaboration with communities. And certainly through the program, developing peer networks and really supporting practitioners and taking up further research and funding opportunities. So really that focus on the what next and signposting those opportunities and providing that support as best as we can. In terms of how this course has been developed, Carrie very early on has been developing a practitioner needs assessment survey that was run through the centre, and over early this year, actually, some of you may have been involved, but we partnered with the centre to develop some information sessions to kind of share that feedback and then get further insights about what a training course that would be relevant for practitioners would look like, both in terms of the practicalities as well as the content. And that's been worked through, and that's very much informing even the kind of logistics of when we're organising the training sessions, for example, based on the feedback of practitioners. So if you've been involved in that survey, thank you very much. And this hopefully honours the kind of the learning from that and really tailors it as we go along. Obviously, we launched just a couple of weeks ago, and the training programme itself will actually start in October. And so there's plenty of time still to register for that, and the plan is for that to continue up until March. And we'll be reviewing things as we go along and thinking about what the further support might look like moving after March. But certainly from our perspective, things like there'll be integrations with the Community Knowledge Matters network, so there'll be community practices where we'll be able to support yourselves to get involved in that if that's appropriate, to find community partners. And to continue that kind of shared learning and space for shared practice. In terms of the core design of the program, the focus based on lots of different the feedback, but we are doing live interactive online training sessions. It's going through the whole process around research really, and obviously tailoring it towards remote, rural and island contexts. So for example, we'll be inviting different speakers and different trainers, people with different experiences, so even community members who've been doing remote, rural and island research to talk on these training sessions and give plenty of time for interaction as peers and sharing and discussion within those sessions. So they're an hour and a half on the Wednesdays once a month, and over time we'll kind of build up a kind of the whole curriculum. What was also really important was the peer support and the flexibility that was required through that. So knowing that everyone's coming from different places and has different projects and interests, is that we'll be supporting this peer support through things like community of practices. So these will also be online, and the designed to complement the content of the kind of training sessions themselves. So hopefully it's time to kind of expand on the data and the kind of information, to contextualize. And for those of you who might not be able to make a live session in particular, it's a chance to almost a bit of a flipped classroom model where hopefully you'll get a copy of the slides and the worksheets to work through, and then you can still come to the community practice to kind of put that into practice and apply it, and also be able to ask questions. We're also planning for the community practice to potentially be able to invite different kind of speakers. So if there's a specific thing that was raised from the training session that everyone or people are really interested in, where we can, trying to really tailor those community practices to, again, give you that kind of next step, as it were. So yeah, we're going to be working hard to make it flexible and iterative, and as the program develops, really kind of tailoring it based on the different needs of the group, and finding that that kind of, yeah, something for everyone. And of course, we want it to be forward facing. So throughout, there's very much going to be space to think about next steps, building collaborations, building networks, and further opportunities, whether that be funding, other training opportunities, as we go along. So just maybe a little bit more about the live workshops in particular. So to give as much notice as possible, we've fixed these to the Wednesdays, and that was came from the feedback. Actually, Wednesday afternoons tends to be the best for practitioners. I appreciate that's not for everybody, and so we've got the program and the dates planned in advance, just so there's as much notice as possible. The first session will very much be a welcome session, but also covering some of the core foundations of what collaborative research design could look like. And RRI is remote, rural, and island, just to be clear. And probably getting a bit of a sense of where people are, what research people are doing, and kind of exploring lots of different types of research, just to get a kind of a foundation of that, whether that's from action research, participatory research, systematic reviews, co-production, those different types of models. The session in November will start looking at ethics in particular, and what ethics processes might look like, both in terms of institutional element of ethics review, for example, but also actually thinking about what ethical practice looks like more in general within rural communities. There are very specific considerations about anonymity, for example, that are particularly difficult within place-based remote rural contexts. And so we'll be focusing a lot more on that, and very much using some of our case studies from different community-based research projects, but also thinking about kind of small samples, historic kind of perceptions of research, stigma around mental health, for example, and kind of discussing that through. In December, we'll be focusing a bit more about survey design and interviews, and again, thinking about that within the context of small populations. And again, maybe drawing some of our learning about maybe some more creative ways of being able to do surveys, or ways of collaborating with communities or people with lived experience to develop surveys and analyze them as well. And then also similarly thinking about peer based interview processes, for example. Our session in January feels like a long time away, but it will come very quickly. We'll look at maybe different examples of more creative-based approaches or participatory approaches to thinking about different research methodologies that can, again, work within real settings. We'll share lots of different case studies and give a bit of an idea of how this might work in practice as well. And very often, if you're working with collaborators, what that might mean. And then we've kind of flipped maybe the more traditional way of thinking about it, but we've put in February a session particularly about next steps and funding, just so I suppose before the program ends, that will be a bit of a thread throughout, but actually having a dedicated session, looking at different opportunities, looking at how you can apply for funding. Very often it's just being awareness is one of the biggest things that came through the survey. So really trying to bring different people into the room to talk about what opportunities there are moving forward. And hopefully that's a really great dedicated time to start thinking about the what next after March. And then the final session is looking at the kind of publication process, what that might look like, but also just thinking about different ways of disseminating, both with communities, but also looking at practitioner impact. Could be more policy briefs and resources, and how, again, thinking about collaboration with communities, how that could be embedded throughout. So hopefully that gives you a little bit more context to the different sessions. After each session, the recording and worksheets will be shared, and that will hopefully be both useful for those who obviously could join live, but also who couldn't make a specific session. And then in between each of these, roughly around 2 or 3 weeks after each of the online workshops, there'll be a community of practice, which is about an hour. These times haven't been set yet, so we will be asking you when you register when might work best for you, and we'll try and do our best to find a time that suits the most of the practitioners, that then complements the kind of monthly live workshops on the Wednesday. Though it could end up still being on the Wednesday if that turns out to be the best for folks. And the idea around that is, again, it's a space to kind of extend the learning, to really apply it, to ask questions, and for us to potentially invite different speakers to kind of complement the content as we go along. Just in terms of eligibility, taking quite a broad perspective on the health and care practitioners and who can apply. Ideally, you will be Scotland based and you are either really interested or already working within remote, rural and island communities, but you do not need to have any prior research experience. So we are trying to kind of pitch it at all the different levels. If we do end up in a position where we're oversubscribed, we may try and prioritize applicants, but we're aiming for around a cohort between 12 to 15, just so it doesn't feel too big and that you get a chance to really understand and learn from everybody as well and get to know everybody. So just to give you a sense of the size of the cohort that we're hoping to do. In terms of time commitments, you can read it, but obviously the live sessions are about an hour and a half. The community practices will be an hour, and obviously these are the types of things that you can dedicate as much time as you can, and the more time you put in, hopefully it'll give you back more. But we estimate at least 1 or 2 hours per month for self-study, and so roughly the time commitment is about 4 to 5 hours. Ideally, please do attend live where possible, and obviously things like the community practices, the more people who attend and share and catch up with things, the better. We appreciate it. It is always difficult. The biggest barrier is always time. So that's why we've designed it to be as flexible as we can, but where possible, we do ask for that commitment. And it is fully funded by the National Centre, which is fantastic. And if it's useful at all, we can provide a letter and rationale to help secure that protected time. If there's anything else we can do to help you try and protect that time, just let us know. And when you register, you can also let us know if, in particular, if a letter would be useful, and we can get that sorted. So I'll finish there. In terms of what next, obviously, if you're interested still, do register online as soon as possible. We will be allocating things periodically up until the deadline of the 7th of October. But if you are interested, recommend you doing that sooner rather than later. Of course, please do feel free to share the opportunities as well if you have colleagues who might be interested. And if you are interested in the Community Knowledge Masters Network or the Centre's National Stakeholder Network for research and evaluation, we will share that by email as well. And of course, if there's any other questions, we've got a bit of time today for those joining us live, but for everyone else, feel free to send an email to myself or Carrie. Thank you very much.